Welcome to Everything Medical. Today's video is all about the anterior compartment of the thigh. So stay tuned. Endeavor to stay to this class to the end because I'm going to be discussing the musculatures in the anterior compartment of the thigh region. This diagram here will give us a clearer view on how the thigh is being compartmentalized. I'm going to be discussing how the thigh is compartmentalized before talking about the anterior compartment of the thigh region, which is where this class is going to be centered. As you can see this diagram, the thigh is enclosed or covered by a fascia sheet known as the fascia lata. The fascia lata encloses the thigh like a sleeve or a stocking. The fascia lata can be called the iliotibial band. So here is the fascia lata. This is the fascia lata. It encloses the thigh like a sleeve or a stocking. Extending inward from the fascia lata are the three intermuscular fascia septum. Those three intermuscular fascia septum works to compartmentalize the thigh. Right here is the lateral intermuscular fascia septum. Right here is the medial intermuscular fascia septum. Right here is the posterior intermuscular septum. These three fascia intermuscular septum extend inward. They passes from the inner aspect of the deep fascial sheet of the thigh to the linear aspect of the femur to compartmentalize the thigh into three compartments. Right in this space is the anterior compartment of the thigh. Anterior compartment. Why this space indicates the posterior compartment. This space right here indicates the medial compartment of the thigh. The medial compartment. These compartments have their different respective blood vessels and nerves. As you can see, the anterior compartment is bounded by the lateral intermuscular fascia septum laterally and the medial intermuscular fascia septum medially. This is where we're going to be discussing. So the principal nerve of the anterior compartment is the fascial nerve. The femoral nerve. The femoral nerve. The principal nerve in the posterior compartment is the sciatic nerve. While the principal nerve in the medial compartment is the obturator nerve. The anterior compartment can be called the extensor compartment because those muscles in that region work collectively to extend the knee. The posterior compartment can be called the flexor compartment. The medial compartment can be called the adductor compartment. Adductor compartment. Okay, the lateral intermuscular septum is the strongest among the other two intermuscular facial septum, which is the medial and the posterior intermuscular septum. The lateral intermuscular septum is the strongest, and it extends from the iliotibial tract to the lateral lip of the linear aspera of the femur. While the medial compartment attaches to the medial lip of the linear aspera of the femur, the posterior intermuscular septum is poorly defined. So this is how the thigh region is compartmentalized by the three intermuscular facial septum. As you can see, this is the femur bone. This is the femur. So our major concern on those compartments is the anterior compartment. We'll be discussing the anterior compartment in this video. So the component of the anterior compartment. What are those muscles that are found in the anterior compartment? Number one is the quadriceps femoris. Number two is the articularis geni. Number three is the tensor facial latae. Number four is the sartorius muscle. The sartorius muscle. So these are those muscles that are found in the anterior compartment of the thigh region, which can be called the extensor compartment. We have the artery. The artery is the femoral artery. You have the nerve. The nerve in the anterior compartment is the femoral nerve. The femoral nerve. So these are the components of the anterior compartment of the thigh region. So now we'll be discussing the muscles, because that these muscles, they work to extend the knee joint. That is why that compartment is called the extensor compartment of the thigh region. Okay, let's start with the quadriceps femoris. The quadriceps femoris. The quadriceps femoris muscle is a group of 4 individual muscles because they have different origin. That is the proximal attachment, but could have the same insertion, which is the distal attachment, because they form a quadriceps femoris tendon to be attached or inserted into the base of the patella. We have 4 muscles that form the quadriceps femoris, 4 individual muscles. Those 4 muscles include the quadriceps femoris here, we have the 4 muscles. We have the rectus femoris, and 3 vastus muscles. Three vastus muscles. In these three vastus muscles, we have the vastus lateralis, the vastus intermedius, and the vastus medialis, which forms the three vastus muscles. Recall that the quadriceps femoris forms majorly the bulk of the muscles in the anterior compartment of the thigh region. It is the most powerful extensor of the knee joint because all these muscles here functions to extend the knee joint, except the rectus femoris, which also functions to flex the hip joint. Why? Because the rectus femoris crosses the knee joint and the hip joint. That is why it is able to flex the hip joint and as well extend the knee joint. But the three vastus muscles only extend the knee joint. They don't flex the hip joint because their fibers or their tendon do not cross the hip joint. They only extend the knee joint. That was an important clarification to note. You could see it in the MCQ question, the medical board exam. Okay. The next to be discussing is the rectus femoris in detail. The rectus femoris. The rectus femoris. From the name rectus, rectus in Latin simply means straight. It means straight. It means what? Straight. So the rectus femoris is a long straight muscle with a fusiform bipennate belly on its upper 2/3 and a flat tendon on its lower 1/3. This muscle right here is the rectus femoris. It means straight in Latin, so it is a straight muscle. As you can see it on this diagram, it is what? A straight muscle. So we'll be discussing it based on the following headings: the origin, the insertion, the action, and nerve supply. What is the origin of the rectus femoris? The rectus femoris has two heads of origin from the ilium of the hip bone. Ilium is one of those bones that forms the costal bones. That is the hip bone. Okay, it has two heads of origin. Right here is the reflected head of rectus femoris. Reflected head of rectus femoris. While here is the straight head. The straight head. This is the straight head of rectus femoris, while here is the reflected head of rectus femoris. The straight head of rectus femoris originates from the upper part of the anterior inferior iliac spine. Anterior inferior iliac spine. This is where it originates, a part of the ilium. While the reflected head of the rectus femoris originates from the groove above the acetabulum of the hip bone. It originates on a groove above the acetabulum of the hip bone. That is why it does what? Originate. Okay. The next to be discussing is the insertion. The insertion. Recall that the quadriceps femoris muscle is a four individual muscle. They unite together to form a tendon known as the quadriceps femoris tendon to be inserted at the base of the what? Of the patella. That is where they got inserted, the distal attachment. So the insertion of the rectus femoris is particularly at the base of the patella because the flattened tendon of the rectus femoris descends downward vertically to be inserted at the base of the patella. This is the base of the patella. This is the base. This is the base of the patella. It's a landmark because most of the muscles of the quadriceps femoris is inserted at that region. Why this is the patella itself? As you can see in this diagram, this is the quadriceps femoris tendon, in which those four quadriceps femoris muscles unite to form, to be inserted at the base of the patella. Some is inserted at the lateral aspect of the base of the patella. Some are inserted at the medial aspect of the base of the patella, or the lateral border of the base of the patella. It depends on the muscle. So this is the quadriceps femoris tendon. The quadriceps femoris tendon. This is our patella bone. Okay, after the quadriceps femoris tendon has inserted at the base of the patella, at this region right here, there is a ligament known as the patellar ligament, because extending downward, the ligament of the patella, which is the patellar ligament, extend downward to be attached at the tibia tuberosity. This is the tibia tuberosity. This is the patellar ligament. The patellar ligament. This is as well the patellar ligament, right here. Important to note, the quadriceps femoris tendon has a secondary function in stabilizing the patella. That means those muscles of the quadriceps femoris has a secondary function in forming the stability of the patellar bone, in alongside with the patellar ligament, because the quadriceps femoris tendon helps to stabilize the patella and as well its patellar ligament. Recall that another name of quadriceps femoris tendon is the patellar tendon. That is its another name. Okay, that is how it works on this region. Then the action of the rectus femoris is to extend the knee and flex the hip. That is why the rectus femoris can be called the kicking muscle. It can be called the kicking muscle. Why is it called the kicking muscle? Because extending the knee and flexing the hip are the mechanism that is needed in a kicking movement. That is why it's called the kicking muscle, because it extends the knee and flexes the hip. The nerve supply. The nerve supply of rectus femoris is the posterior division of the femoral nerve. That is the nerve supply. So this is the rectus femoris. The next muscle we'll be discussing is one of those vastus muscles. We have the vastus lateralis. The vastus lateralis. The vastus lateralis muscle. Okay? The vastus lateralis. We're discussing it based on the origin, insertion, action, and nerve supply. Nerve supply. What is the origin of the vastus lateralis? The vastus lateralis, it forms a linear and aponeurotic origin. Look at it here. This is the vastus lateralis. This is the vastus lateralis. What does it do, or how does it originate? It originates as a linear and aponeurotic origin. It forms a linear and aponeurotic origin at the upper part of the intertrochanteric line. As you can see it here, this is the site of its origin, because proximally is the origin of the quadriceps femoris, while distally is the insertion of the quadriceps femoris muscles. So it originates by forming a linear and aponeurotic origin at the upper part of the intertrochanteric line. That is the number one. The number two place that it forms its origin is the anterior and inferior borders of the greater trochanter and the lateral lip of the gluteal tuberosity. It also originates at the lateral intermuscular septum. That is the origin of the vastus lateralis. Now, the insertion. The vastus lateralis muscle inserts with the quadriceps femoris tendon. That is the tendon of the quadriceps femoris. Get. And now, as you can see it here, it forms a good insertion at the base of the patella. It inserts at the lateral aspect of the base of the patella. That's the number one insertion. It also inserts at the upper one-third of the lateral border of the base of the patella. And it also forms a reticular fibers in front of the lateral condyle of the tibia. That is how it inserts. That is the insertion of the vastus lateralis. It inserts at the lateral side of the base of the patella, the upper one-third of the lateral border of the base of the patella, and also forms reticular fibers in front of the lateral condyle of the tibia. So that is the insertion. The action is common. It extends the knee. The nerve supply is also the posterior division of the femoral nerve. That is the nerve supply. Okay. The next muscle that we'll be discussing is the vastus medialis. The vastus medialis. Here is the vastus medialis. Because why is it called medialis? Because it is located at the medial aspect of the anterior compartment of the thigh. Why is vastus lateralis called lateralis? To be precise, because it is found at the lateral aspect of the anterior compartment of the thigh. That is why it bears the name lateral concept. That is the lateralis, because it's found at the lateral aspect of the anterior compartment of the thigh. Why this one is called the vastus medialis? Because it is found at the medial aspect of the anterior compartment of the thigh. Vastus medialis. Okay. The vastus medialis origin. Recall that the vastus medialis covers the medial aspect of the surface of the femur. It covers the medial aspect of the surface of the femur. That is what it does. And it originates from the lower part of the intertrochanteric line. Look at it here. It originates from the lower part of the intertrochanteric line. That is the number one origin. On the second origin, or the number two origin, it originates from the medial lip of the linear aspera of the femur. That is the number two origin. On the number three origin of the vastus medialis muscle, it also originates from the medial intermuscular septum. That is what that forms its origin altogether. This muscle, they don't have a single origin, like a particular origin where it arises, because the fibers are attached all through at the upper aspect of the femur. You get? They don't have a single origin. That is why it have up to 3 or 4 origins. Okay. The insertion of the vastus medialis. The vastus medialis muscle is inserted alongside with the quadriceps femoris tendon. That is to say that the tendon unite with the quadriceps femoris to form that quadriceps femoris tendon. Now, it also insert at the base or at the medial aspect of the base of the patella. You can see it at this region. It inserts at the medial aspect of the base of the what? Of the patella. And it also forms its insertion with the quadriceps femoris tendon, which insert at the base of the patellar bone. What is the action? The action is to extend the knee. The nerve supply is the posterior division of the femoral nerve. The next muscle is the vastus intermedius. This is the vastus intermedius. The vastus intermedius. The origin of vastus intermedius is from the anterior and lateral surface of the femoral shaft. That is the origin. It originates from the anterior and the lateral surface of the femoral shaft. That is the origin. Okay. Now, where does it insert? Where does it insert? It inserts at the base of the patella, deeply to the rectus femoris muscle. That is the insertion of the vastus intermedius. It inserts at where? The base of the patella, deeply to the rectus femoris muscle. Look at the vastus intermedius here. This is the rectus femoris. So it inserts at the base of the patella, deeply to the rectus femoris muscle. Now, the action is to extend the knee. The nerve supply is the posterior division of the what? Of the femoral nerve. That is all about the quadriceps femoris muscle. We have discussed their origin, the insertion, action, and nerve supply. Okay. Let's delve into the another muscle, which is the sartorius muscle. The sartorius muscle. The sartorius muscle. This sartorius muscle can be called the talus muscle. It is the longest muscle in the human body. It is long and thin. You get? It runs obliquely in an inferior medial direction in the anterior compartment of the thigh. As you can see it here, it is a long muscle. It runs obliquely in an inferior medial direction. You get? In an anterior compartment of the thigh region. This sartorius muscle originates from the anterior superior iliac spine. Anterior superior iliac spine. That is the origin. You get? It then inserts, the insertion now, it then inserts at the upper part of the medial surface of the shaft of the tibia. Upper part of the medial surface of the shaft of the tibia. That is the insertion. Now, what is the action of sartorius muscle? Recall that it is found in the hip joint region and it is found in the knee joint region. So, the sartorius muscle is the lateral it is the lateral rotator of the hip joint. It also flexes the hip joint. It is the lateral rotator of the hip joint. It also flexes the hip joint and also abducts the hip joint. While in the knee joint, it is only the flexor of the knee joint. So that is all about the action of the sartorius muscle. On the nerve innervation, it is being innervated by the anterior division of the femoral nerve. It is the only muscle in the anterior compartment of the thigh that is innervated by the anterior division of the femoral nerve, while the quadriceps femoris muscle is innervated by the anterior division of the posterior division of the femoral nerve. The quadriceps femoris muscle is innervated by the posterior division of the femoral nerve, while the sartorius muscle is innervated by the anterior division of the femoral nerve. The next muscle we'll be discussing is the tensor fascial latae. Tensor fascial latae. The tensor fascial latae is not actually the muscle, like the main muscle of the anterior compartment of the thigh, just that it runs laterally from the gluteal muscle. During embryological development, or morphologically, it is regarded as the gluteal muscle because the nerve innervation is a nerve from the gluteal region, which is the superior gluteal nerve. Just that it runs laterally to be inserted at the iliotibial tract. So it is now being considered as the muscle of the anterior compartment of the thigh. But it does not bear any nerve innervation from the femoral nerve. It takes an innervation from the nerve in the gluteal region, which is the superior gluteal nerve. Okay. Now, what is the origin of the tensor fascial latae? The tensor fascial latae originates from the outer lip of the iliac crest. Outer lip of the iliac crest. Outer lip of iliac crest. It originates from the outer lip of the iliac crest, expanding between the anterior superior iliac spine and the tubercle of the iliac crest. That is in between it. Okay. What is the insertion? This is the point of the insertion. It inserts at the iliotibial tract below the level of the greater trochanter. This is the iliotibial tract. This is the iliotibial tract. Iliotibial tract. That is the point of the insertion of the tensor fascial latae. Now, the nerve supply of the tensor fascial latae is the superior gluteal nerve because the muscle is actually the muscle of the gluteal region. Just that during development, it extends laterally to the anterior compartment of the thigh, but it takes the origin of the nerve, or it takes the innervation of the nerve from the gluteal region, which is the superior gluteal nerve. Okay. The next muscle we'll be discussing is the articularis geni. Articularis geni. Articularis geni. This muscle is just like a detached part of the vastus intermedius, because from here, this is the femur bone. So the muscle is way on this region, just like this, a small muscle, just like this, you get. And it lies deeply to the vastus intermedius. That is why it takes a tweak from the nerve to vastus intermedius, you get. So the articularis geni is composed of 4 to 5 muscular lips, which is regarded as a detached part of the vastus intermedius. What is the origin of this muscle? What is the origin? What is the origin? It originates from the anterior surface of the distal femur. They originate from the anterior surface of the distal femur, deeply to the vastus intermedius. Okay, now the insertion. It inserts at the upper part of the synovial membrane of the knee joint. As you can see now, it is way closer to the knee joint. You get. So it inserts at the upper part of the synovial membrane of the knee joint. That is the articularis geni. Now the action. What is the action of this muscle? This muscle acts to pull the synovial membrane of the knee joint upward in order to prevent it from a damage when the knee is extended. That is the primary work of the articularis geni. It pulls the synovial membrane of the knee joint upward to prevent it from a damage or a lesion when the knee is extended. Okay, the nerve supply. The nerve supply. The nerve supply of the articularis geni is a twig from the nerve to vastus intermedius. That is the nerve supply of the articularis geni. Recall that on this diagram is just like showing the knee joint, the patella, and the quadriceps femoris tendon, and the patellar ligament. So that is so that this is the femur. This is the what? Tibia bone. So we have done justice to the muscles in the anterior compartment of the thigh region. We have discussed the fascia compartment of the thigh, how the thigh is compartmentalized with the fascia. That is the three intermuscular fascia septals. Okay, I believe you understand this class to the end. Understand it to the end. Okay. I want to give you a special thanks for staying into this class. Anticipate for more videos on the lower limb anatomy. If you have any question, write it down on the comment section. Thank you so much for watching.